Dr. Paul, I guess a question I got is Lexapro versus Zoloft, which is better for anxiety? It was a good question because people get confused with the word antidepressant. Some people say, well, I'm not really depressed so much, I'm really more anxious. And what can I take for anxiety? Well, generally, rule of thumb is the best treatment for anxiety is antidepressants, but it's got to be the right one. So between Zoloft and Lexapro, they're fairly close call. They're both good SSRIs. They're the two most common ones, which is why I probably got the question, because they're the two ones that most doctors are familiar with, and that they're the most prescribed out there. Probably Lexapro over Zoloft, but they're both prescribed a lot. And again, the SSRIs are good. They can be good for anxiety with some people, which again is just fixing the leak at the serotonin site and then forcing serotonin to move forward. But when it comes to anxiety, the better class often, not always, but often, is the SNRIs, because most doctors do not recognize it. I think SNRIs, which work on serotonin and norepinephrine, I think they're the best first line for anxiety overall. So I would usually start there. I would skip by the SSRIs, and the only reason I would switch to an SSRI is if for some reason the SNRI is not tolerated, or if it gives someone too much energy, or the dry mouth too much, or we want with medications is results with no significant side effects. That's always the goal. And if you're getting significant side effects, we stop it, or we lower the dose, or whatever. But so when it comes to anxiety, like I said, what I discovered, back 32 years ago, when the first SNRI came out, and all we had at that point were 3 SSRIs. Lexapro wasn't out yet. Zoloft was out. But I really discovered with the power of norepinephrine and how much of a role that plays with anxiety, as well as physical symptoms that anxiety causes, muscle tension and pain. The other chemical to look at when it comes to anxiety is GABA. So if we're not getting the answers here, or if we're getting the answers, but people get 50% better, which is a good start, but we're not there yet, then I'll often add an agent that works on GABA. And the two I would use most for anxiety would be Gabapentin and Topamax. Now, Gabapentin we use a lot for pain. We use it for anxiety. It works great for both. Topamax is unique because it works for both of them, but it also provides potential weight loss because it curbs appetite, especially the desire for sugars and carbs. We call stress eating or comfort foods. So stress eating means sugars and carbs, especially in the evening time for most people. So Topamax, you throw that in there and you get GABA moving that way. And that can really, and sometimes I'll combine an SNRI or SSRI with the GABA agent, and that combination is a very powerful thing for anxiety. So sometimes it's not just one thing, it's a matter of how to combine things and how to know how to do that. So hopefully that helps. Hopefully that answers your question.